Carl Mercurio, and this is Healthcare Week in Review. The debate over universal health care in America is heating up. On one side, advocates of single-payer health insurance or government-run health care. On the other side, proponents of market-based, consumer-driven health care. In between, a system in crisis. Here to talk about the myths and realities of universal health care is Standard & Poor's chief economist, David Wyss. David, thanks for joining us.
Good morning.
Well, let's talk about first the universal single-payer and government-run systems. We hear a lot of information and misinformation about these programs. Are they, in fairness, a viable alternative to the U.S. system?
Well, sure, they're a viable alternative. Half the world uses them, and certainly they've been very successful in the Scandinavian countries, the UK, Canada. Generally, they seem to yield the best possible care for the lowest possible cost, but at a lot of expense in terms of consumer choice.
What are some of the downside? You mentioned consumer choice. We hear about waiting lists. Some people say that's overblown. Some people say it's not. What are some of the downsides?
Well, waiting lists are real, and they do affect you. I think I lived in England for 4 years, so I had some experience with the system over there. Generally, if you have anything that's life-threatening, your care is as quick and as good as it is over here, but you're probably, you're not going to be in a private room. The negative side to it, though, is if you have something that's quality of life related, things like hip replacements, for example, you go on a waiting list. One good side effect of it, we built up a big medical tourism business in India for people that can't get hip replacements in London.
One of the data points that seem to be most damning for the U.S. system is the information that shows we spend far more than industrialized nations on health care, yet our care and our outcomes are worse. Is that alone an argument for a single-payer government-run system?
Well, it's certainly an argument for changing what we've got now. I'm not sure you have to go to a single-payer system. Germany does fine with an insurance system, but it has to be a universal coverage. And we don't have that. The problem is for the 80% of the people with access to solid insurance, we probably have the best healthcare system in the world, but 20% of them are just left out of the system.
The criticism quite often is goes to the health insurance industry. I had the opportunity to see Michael Moore's new movie in a screening, Sicko, and he really takes it to the health insurers. Are they the ones to blame for this problem largely?
We can't really blame them for it because, they're suffering the same problems that everybody else is. They're paying higher and higher bills to people for worse and worse results. The results aren't their problem. The costs aren't really their problem. To be fair, the administrative costs of our system are higher than anywhere else in the world.
That's the argument against the insurers.
But that's partially the way the system is set up. And, of course, you also have to realize malpractice insurance comes in under administrative costs.
And the care denial part of it, one of the things that strikes me as the core of insurance is it protects you from being bankrupt, from health care bills. And they seem to have fallen down in some instances on providing that protection to their own customers.
It depends on the insurance system. Some of them are better than others, but there's no question. There are insurance which is simply inadequate, and it's sold to people as though it were adequate. What people really need coverage for is catastrophic illness. Unfortunately, what they prefer to buy is first dollar coverage, sort of your ordinary day-to-day medical bills.
And then finally, we've been down this road before throughout our history. We've talked about universal health care, but we've never been able to pull the trigger on a system. Are we at the point now where we have the political will to actually do this? Universal health care in some form, whether it's single payer, a partnership, but something that gets everybody covered and gives them the coverage and insurance they need.
I'm not convinced that nationally we have the will to do it. I don't think we're willing to make the trade-offs. I don't think people have enough confidence in going anywhere. I think you are going to see it happening at the state level, places like Massachusetts, the reforms in Oregon, Hawaii, Maine. I don't know if it'll go to a single-payer system or an insurance system like Massachusetts is, but I think at least at the state level you're going to see that move towards better coverage, universal coverage, and down the road at least, cost control.
Great. Thanks very much. From the Standard & Poor's offices in New York, I'm Carl Mercurio.